welcome. I'm Bridget, your moderator for today's Fireside Chat hosted by Responsum Health, and we're thrilled you're joining us for How to Stay Off Dialysis, Tips for Taking Charge of Your CKD Journey. Today's conversation is all about empowering you with practical guidance to protect your kidney health and take charge of your CKD journey. Before we dive in, let me introduce our amazing speakers. First off, we have Kevin Fowler, patient advocate and principal of the Voice of the Patient, Inc., with leadership roles in several kidney organizations, including the American Association of Kidney Patients and the Kidney Health Initiative. Dave White, ambassador of the American Association of Kidney Patients and active leader in kidney advocacy. Nichole Jefferson, patient advocate and member of the Kidney Health Initiative Patient and Family Partnership Council, as well as the NKF Kidney Advocacy Committee. And popping in a little bit here will be Dr. Brent Miller, endowed professor of clinical medicine and clinical chief of nephrology at Indiana University. A quick few housekeeping notes. This session is being recorded and will be available later in the Responsum Health app and via email. And everything shared today is educational, so please check with your care team for personal medical advice. That being said, drop your questions in the chat anytime, and we'll answer as many as we can during the live Q&A at the end of the session. All that being said, thank you again for being here. So let's get started. Starting at the beginning, understanding your kidney health and the value of early detection. Many people assume that dialysis is inevitable, but that's not always the case. And early awareness and correct diagnosis can make a huge difference. So with so many people thinking that dialysis is unavoidable, can you please share your perspective on why that isn't true? Dave, would you like to start?
Sure, I'll be happy to start.
Just
I'm
on
probably not the best person to start because I was my health literacy wasn't very good. Most of my life, I'm pretty sure that I knew that I had two kidneys, but not 100% sure. Okay, and I had a lot of unhealthy habits as well, which we don't have to waste time going into, but smoking cigarettes, being overweight, and the worst was not going to the doctor for a long time. So I didn't know my health status. So I think the most important thing people have to know is to know your status, especially before it's too late to do anything to avoid dialysis. And I'll just stop there and let people who have been more proactive, throughout their lifetime, speak to this to their experience.
Thank you, Dave. I'm sure a lot of people can relate to where you came in from as well. Kevin and Nichole, do either of you have any thoughts on why people think that dialysis is unavoidable?
Yeah, I'll speak to. I think first of all, Dave has given himself too hard a time on himself. I'm guilty of some of the same things that Dave said. So, I think it's dependent upon the type of kidney disease that you have. So I think a lot of times people make this or have this false impression that kidney disease is this monolithic disease, and the real correct term is kidney diseases. And so I think the most important thing is to understand if you are diagnosed with kidney disease, what type of kidney disease it is, because having the correct diagnosis and then having the correct treatment are now a possibility. There's medications approved, SGLT2 inhibitors for diabetes and kidney disease. There's medications for IgAN. There are hopefully medications for FSGS. So there's all this exciting innovation coming forward. But if you don't know the status of your kidney function, it's kind of hard then. And so that then really consists of making sure that you're seeing the right physician or I'm sorry, the right nephrologist, because they're different. So my advice to everyone is, first of all, and I hear this a lot of times when people have had kidney failure, I've talked to them and I said, what was the cause? And they say, my doctor never told me. So I think that if the most important thing I would say to this group is that if you've been diagnosed with kidney disease, what type of kidney disease do you have? And if you're not comfortable with the answers you're getting, I encourage you to get another opinion. So I've talked a lot there. I'll pass it on to Nichole.
Hey, hello. Uh, like Dave, with my first kidney, I crashed into dialysis. I wasn't even sure what was going on. I had no idea. Although I was active about my care, I was just at the doctor, within a week of even crashing into dialysis. So I did make sure that I knew what was going on, or at least I thought I did. However, when it was time to get a second transplant, that was when I knew it was up to me to beat dialysis. I did not want to go back on dialysis because I had such a horrible and terrible time on dialysis. It affected me very negative. So I made it a goal to not go on dialysis the second time. But in order to do that, I had to listen to my body. The doctors were telling me that there was nothing wrong with me at the time and that my kidney was fine, but I kept asking, hey, I need a biopsy. I need something to find out what's going on because I just felt in my own self. I knew my body and I knew that the kidney was failing. So I made sure to, go to another doctor, threaten to go to another doctor for other things to make sure that they listened to me and they did the biopsy to understand that yes, my kidney is failing. And so with that, I just continued to look. I continued to look at my numbers, make sure my numbers were okay. I made sure, how I felt to make sure that I did feel okay, as though, to make sure I didn't need dialysis, so that I could tell the doctor, in uncertain terms, hey, I don't feel I need dialysis because of this. And I even went so far as to get a second opinion from another nephrologist to say, no, Nichole does not need dialysis at this point. And just when it was time for me, when I did decide it was time to go on dialysis, I was able to get a transplant. So I was able to be dialysis that second time.
That's incredible, just listening to your body and being willing to advocate for yourself so fervently. So I have a question here. I'm wondering, do any of you have any experience hearing common misconceptions when people are talking to you about dialysis or just their own experiences of what to expect? Is there anything that you hear often that may not be true?
The one thing I'll say, the first one is that people think you have to be in center to do dialysis.
Mhm.
You can go home. Sometimes people aren't told that they can go home, yet other people are told, but they have this misconception about everything you have to do when you're at home in order to have dialysis. There's not just one way of doing dialysis at home. There are about three different choices you can make, three to four, and you choose what's right for you and what works best for you on your day-to-day life.
I'll just say this. I think that there's a narrative that's formed in the community that just accepted people going on dialysis. And it's almost like this is just acceptable. And it's not acceptable in my mind. And the reason it's not acceptable, there's a couple of reasons. One, as I mentioned, you've got these influx of all these new medications that can slow down the progression, which gives you time. And there's also a lot of clinical trials out there. So I always look at clinical trials as another option as far as like a treatment option. So I look at that way. So it's going back and if you're sensing like you're not sensing a lot of confidence in that doctor, like Nichole said, trust yourself. Trust the power within yourself that you know what the right thing to do is and have that guide you. I'll just, when I was diagnosed with my kidney failure, and Dave, similar to you, I kept my head buried in the sand because my mom had polycystic kidney disease, died on dialysis. So my approach was to say, I'm just going to keep my head buried until one day I finally had the courage to get tested and find out that I was going to kidney failure. But even in that situation too, when I was going into kidney failure, I just didn't trust this primary care doctor to make a referral. And so I didn't accept his referral. I ended up going to Dr. Miller, who hopefully is going to be joining us. But I didn't have to go on dialysis. I didn't go on dialysis. I ended up having to preempt the transplant. But that's also due to biases in the system that favor people of my skin color over Nichole and Dave, where there's clear biases where people are being offered all their options. So, but my belief is believe in yourself, believe in your voice, believe in your power. And if people are questioning you, find another doctor.
Absolutely. That's great advice. And so we're talking a little bit here about why early awareness is so critical for slowing disease progression. And it seems that understanding your CKD stage is the first step. So the next step is what you can do today to help protect your kidneys. And I'd like to chat a bit about these actionable strategies, lifestyle steps, and treatments that can make the real difference in slowing CKD progression. Do any of you have any lifestyle strategies that have made a significant impact in protecting your kidney function?
Well, I am, as my fellow uh, panelists we're all kidney transplant recipients. So we're not on dialysis, but we all are in various stages of chronic kidney disease, CKD. So from that perspective, preserving our kidney function is critical. And some of the things I do to do that are exercise as much as I can. It can be as easy as taking a walk. You can work out at home, doing, body weight exercises. You don't need equipment. You can just, you can do push-ups, you can do stretches, whatever you're comfortable doing. Actually, when I was on dialysis, one of my favorite activities was going grocery shopping. Just, commuting to the supermarket and pushing the cart around, I got a kick out of doing that. And other things that are helpful are paying attention to your emotional health. Whether that's being mindful, you can do mindfulness, therapy. I'm actually in therapy right now, and I connect with my therapist as needed, just to make sure that I'm checking in, as Nichole and Kevin said, just checking in with your system, just to make sure that you're feeling okay. That you don't have any stressful things in your mind that will raise your blood pressure, make you, do stress eating and do unhealthy things that might harm your kidneys. Basically, living like a holistically healthy lifestyle, just thinking about what I can do to stay healthy as on an ongoing basis is something that is always top of my mind.
I love the mention to not only focus on your physical health, but to, keep in tune with your emotional and mental well-being as well.
I think that's an important part that a lot of times people forget about.
Mhm.
Luckily, I was able to find a counselor, a therapist who was able to listen to me. When we started, he didn't know a lot about dialysis other than the fact he had some church members who were on dialysis. And by the end of it, he could tell you almost as much as I could about dialysis. And it just so happens his nephew had kidney failure and was needing a transplant about 3 months ago. And his wife was able to do the transplant, give him a kidney, but it was because of, these years of therapy that I had telling him things that, before were myths or things that people were scared of about donating kidneys and just how to live on dialysis and different things like that. So I just think it's very important that we make sure that, as Dave said, our mental, because that's a big part of this. One of the things that I always talk about is the community that I have here. When I first started, I didn't know anybody else on dialysis. My mom had a coworker I chatted with. There was someone else that someone said, "Oh, I know this person on dialysis." But now, it's by the time I needed my second transplant, I had a community around me. Dave, Kevin, and some of the other ones. And even the fact that I was able to be transplanted without dialysis the second time, I didn't know that until I met Kevin. And Kevin told me, you don't have to go on dialysis. And that's how I was able to advocate for myself to say, no, I need a transplant before that. So part of the mental aspect of this is making sure that you do have people in your corner, people who understand what you're going through, right? Because I have a large family, a very large family. My family, they sympathize with me, they feel sorry for me almost, but they didn't truly understand what I was going through. And so it was me taking and understanding and meeting these, people here that you see, that it completely changed my mental, and it changed the way I looked into things, because that was a big part of my healing journey also, right? Was to be able to pick up the phone, talk to someone who knew exactly what I meant, exactly what I felt, not for someone to say, "Oh, you'll be okay," or to try to pacify me. So, just making sure that you keep your mental as a top priority in this journey, wherever you are in the journey.
Also, I wanted before I completely echo what Dave and Nichole said. I've utilized mental health services during the process after transplant. It's just very normal, and I think that that's one part that our healthcare system doesn't really do a good job. And I would just echo everything that Dave and Nichole said. To me, the exercise is the key. You got to be, keep not it's keeping your heart going, but it's also keeping this going too. But there was a question in here too from a lady, I think it was Mary, asking about biopsy. And I'm not a physician, so I would just ask your doctor why, ask them to give you more of a detailed explanation why they're asking that. It could be related to your diagnosis, and some of those other questions on there are questions about living with a GFR, but that I am not, or nor is anyone else prepared to answer it. That's a medical question that a physician or nephrologist can answer. So I just wanted to make sure that you people there realize we're not ignoring you. But I think it's just also I think especially now with all this innovation coming forward, my counsel to everyone is to know as much as you can, and encourage your teams to teach you. So everyone talks about apps, but really the only app that I keep on my phone that's relevant is my chart, and that's a tremendous source of information that helps me prepare. And like Dave and Nichole, I don't want to lose this kidney, so we're in many ways we have kidney disease as well too, that we do have it, that we're looking with our doctors and to figure out how can we maximize the length of our kidneys. And if we were to go into kidney failure, I've already told my doctor I want another transplant. I don't want to go on dialysis. So part of it's also coaching your doctors too. That's my thoughts too. So anyway.
I just want to speak really quick to Kevin was saying we aren't ignoring the questions that are in there. We aren't. But somebody asked about biopsies. Everything that you do is up to you. However, I'm really big on biopsies because a biopsy was able to tell me what my disease is, which also helped determine how I need to proceed about getting another one. Not only did it tell me what my kidney disease is, it also was able to show that I indeed needed another transplant because my numbers never did show that. So that was the importance of why I decided to get a biopsy on multiple occasions. That was just for me.
And there's also, I just want to make sure we're not ignoring our audience, so we'll keep asking questions. There's a question about finding a group to help with your mental status. And I'm really sorry to hear that this person's going through a difficult time. I mean, if I'll just speak from what I did, I contacted a mental health professional, and that's what I did. And you could ask your doctor, or you can have your insurance and have them direct to someone. But that would be my suggestion, because sometimes the groups. I'm just say this. I'm very selective of who I hang out with post transplant. I want to be around people like Dave, Nichole, that are very positive people and that encourage me. So. There's my endorsement also for a mental health professional.
Circling back here, to the actionable steps, I know we talked about mental health, the exercise, healthy diet. What are some of the ways that you or patients at home can monitor their health at home? you said my chart, does that have options to sort of keep track, hold accountability? What are things that they can do to help monitor?
I think some of the easiest things to monitor are your weight,
Mm.
with the scale. Looking back, before my kidney stopped working, I was overweight. I weighed over 300 pounds, and I started exercising, and gradually, for some reason, I stopped exercising, but I kept losing weight. And like the less I exercised, the more weight I lost, and I was actually looking better. And this just kept on for months. I went from 270, 260, 250, 240. This is great. 230, 220. This is amazing. 210, 200. Something might be going on here, but I looked better. And by the time I was really, really weak and noticing other symptoms like nausea and what was the other one? There are things yeah, the color of my urine became dark. These are symptoms that I noticed, but as I said, I was health illiterate. So I didn't know that these were signs that something really wrong was going on inside me. So that's the one thing I would say is just, monitor your vitals. Look at, if you're still making urine, look at the color. If your urine is foamy, like if you opened up like a washing machine and saw the suds, if it's sudsy, that's a sign that you may be leaking protein in your urine. It's called proteinuria or albuminuria. And these are signs that you may have kidney disease or your kidney disease is worsening. So anything that looks out of the ordinary should be followed up and mention it to your doctor, but just don't ignore it.
I'm just going to add a comment here and just look at the question. Someone was asking about recommendations for diet for people 3A, 3B. I would suggest talking to a renal dietitian, renal nutritionist. I mean, they're an untapped resource out there to help you protect your kidney function. So that would be my speak to that professional.
We have a couple of previous sessions with a renal dietitian that we'll share when this goes out as well. If you want to take a look at past webinars, as well as some articles on renal dietitians and what they do and how to find them, that we'll be sure to include in the resources of today's session. So, sort of piggybacking off that, taking care of your kidneys obviously isn't just what you do at home. It's about working with the right care team and, they're your partner, and staying healthy and advocating for yourself can really change your outcomes, as you've shared, Nichole. What do you suggest to patients that they can find a doctor who is proactive about kidney care? Was it just the initial visit that you had a certain list of questions and then you knew it wasn't the right fit? How do you go about making sure your doctor is on the same page as what you need?
I go based on how I feel about them.
Mhm.
And I've also had I've moved from to different states. Same thing. I had to get the feel for them, and I have a very kind of out there personality, and they have to be able to mesh with that. My doctor, my nephrologist now is leaving, and she had to put me with someone, and this has happened twice. And they said, we made sure we put you with someone who would go really good with your personality, because they know I will jump if I'm not comfortable with somebody. Because, one of the things that I told a doctor, it is an honor for you to be able to treat me. So you have to earn that honor to be able to say you treated me, because this is my body. It's the only one I have. So I take pride in that, and making sure that the people who are taking care of it, they feel the same way about my body that I feel about it. So I just say, if you are uncomfortable with someone, you can leave. And that was one of the first things Kevin told me when I met. You don't have to stay with anybody. You can leave, you can interview. I was going to transfer to a different system. And they tried to make me an appointment. I said, no, before we make an appointment, I need to interview this doctor. I need to have a sit down conversation and talk to them to find out different things. I don't just make an appointment for me. I need to have a conversation. So they weren't willing to do that. So I told them, remove my name, I'll go somewhere else. And you have to be confident in doing that and feel good about your decision and that you can do that.
It's like any, and I think the other thing, if I don't want to cut in front of Dave here, but I think if you, the way that you act, the way that you show your knowledge, you'll be treated accordingly. So if you go in prepared with a set of questions, you establish the tone. And I will just say this, my experience with my physicians over the last 25 years has been great. I've had great doctors. They worked with me. But I think that's the nice thing is that I look for someone who's a good teacher. I'd like to learn. And if someone's going to dismiss me, it's just not going to work. But I've had great doctors. Just take your time, coach, teach. And that's how I view them as my coach and teacher. Because ultimately, it's my job to take care of my health.
I totally agree with Kevin and Nichole. I would add that you have to be prepared, and when you go to your appointment, you can have questions. If you have questions, have them written down. Like in my appointment in my phone, I always have the questions that I'm prepared to ask. And if I don't get an opportunity to ask, I will take charge of the conversation. I will direct the conversation and say, these are the questions that I have today. And also, I've learned to observe the behavior of the people that are treating me. I can tell within the first 30 seconds how the conversation is going to go. Sometimes they want to get right down to what they're interested in, and that may not be what I'm interested in. So I read those cues, and I'm thinking about that as the conversation goes. Literally, the last visit I had, I noticed my doctor taking a quick look at their watch. So I knew that something else was on their mind. So I just sort of, brought their attention back to me. It's like, hey, yes, you only have 15 minutes, but those 15 minutes are mine. Pay attention to me, look me in the eye, and talk to me as a person.
Yes, I think a lot of us have felt that before in the doctor's office. And I love the tip to write it down because, they have their checklist of what they're going through. You can get on their path and just kind of forget. And then you get in the car on the drive home and you're like, ah, shoot. Then you're asking in the portal and all that good stuff. So I love the advice of writing them down and taking that with you. Do you all have one question that you would suggest people bring with them to their appointment? What's the top question you would ask? I
The
guess.
first thing I say is make sure you understand what your kidney disease is.
Mhm.
As Kevin, stated earlier, there are different treatments for different things, but understanding what your disease is, what caused it, that goes a long way. Even later on, I've had kidney failure since 2003, so I'm at 22 years, and it is just I just found out recently, believe it or not, but it's helped me even going forward knowing exactly what my kidney disease is and helps me understand what I should do and what I shouldn't do based on that diagnosis.
Yes, that's definitely an important start and a great starting place to bring in your doctor to.
I, I'll just say mine is, this is post-transplant, but like Dave said, we all you look at 3 people that have kidney disease, they're chronic kidney disease. I just want to have give me state of the union on my kidneys, how they're doing, right? What more can I be doing? What should I be doing? And sometimes coming this is the other part too. This is also coordinate your care. So, asking the question like, for example, I'm taking one of the medications that can increase my, um, it can cause diabetes. And so I was the one that pushed to go see a endocrinologist. So it's not just looking at your care from that office, but looking at broader. And so always ask the question, what more can I be doing?
Yeah, I think my question jives directly with what Kevin just said because we've all had kidney disease for a while, and one thing I've noticed is my what's top of mind for me will change. So from actually from appointment to appointment. So if there's generally one thing that's on the top of your list, when you go into an appointment, and I would say make sure you ask that one question. So
Yeah.
you have an answer or some guidance, or know that you need to go somewhere else to get more information. But I would say don't leave your appointment without asking that one question.
Great advice. So let's see about when should patients start considering transplant options and how does that fit with prevention strategies? Oh, I skipped ahead there. um,
So I'll just,
yeah.
yeah, I mean, Dave and Nicole, if I'm talking too much, just give me a look and I will stop. Okay. So, especially Nicole. Um, but I think that, like for me, it was like when I had my first appointment, my GFR with my nephrologist it was like in the 50s. And I knew I was going to have a transplant. He said it originally was 3 to 5 years, it'll be in 3 years. I said, tell me what I need to start getting ready for. And that was the goal. So, I'll just say this is that I think for me, speaking from personal experience, I think being referred to a nephrologist earlier rather than later is a good policy.
Mhm.
Because I'll just say that speaking from my own experience.
Yes.
I say just also getting someone lined up, telling people you may need a kidney so they can prepare to, possibly have a living donor. If not, if you are at the point where you can be listed, go ahead and get listed as early as possible. Because I had the biopsy, I was able to be listed 4 years before my numbers actually started showing that it was time for a transplant. Because of that, I was able to be transplanted before I started dialysis because I already had that information prepared. I had already started being listed by different places based on the fact that I had gotten the biopsy.
I would advise people to seek out other transplant recipients to learn what a kidney transplant is like. It's I would say for me, it's definitely better than dialysis, but it is not a cure. That's some people have the idea that they'll get a kidney transplant and their life will go back to the way it was. It will not. It's just another stage in your journey. As I said, it's better than dialysis, but it requires a lot of maintenance, a lot of care, a lot of medications, and it's it's sometimes people paint a rosy picture of dialysis life, and it isn't always that way. One example I'll share is in my first year with the kidney transplant, I had back-to-back infections. One was called what is it? CMG? What is it? Cytomegalovirus?
Yeah,
CMV,
CMV.
CMV.
It's very common. Some people are asymptomatic, and some people do experience symptoms. I was one of the asymptomatic ones. And right when I was treating it, and right when it went away, I got infected while I was traveling, and I wound up with a viral infection, and I wound up back in the hospital for about 5 days. And by the time I left, I was at my high school weight. That's how much weight I'd lost. And at one point, I totally lost my appetite to the point where bacon didn't even taste good. So infections are part of post-transplant life. And that's just one example that I can share. And I'll also share that some kidney transplants don't start working immediately. It's called delayed graft function or a sleepy kidney. My kidney did not start functioning completely for about 10 days, and that can be very anxiety inducing. I cried more than once, but eventually Hercules started working. And some people that won't go through that, but these are the things that sometimes people won't share when they are discussing transplant options with you. And that's because they aren't transplant recipients. People who have experienced transplants will tell you a different story. And once again, I'll say, for me, with all that I've just said, I love where I am now, and I will do everything in my power to avoid dialysis going forward.
Absolutely. That kind of reminds me back to what Nichole said earlier about just who you're around and those that can empathize with you rather than sympathize. Just speaking to those that, have experience so you know what to expect moving forward is incredibly helpful. So,
If I could piggyback on Dave said, I think Dave said really right. I mean, if I had my druthers, would I prefer to have my native kidneys? Absolutely. Am I grateful for what we've received? Absolutely. But it's a full-time job that never stops, right? And so you're talking to three people here who've been through it. We've figured out the mental part, but sometimes that's the part a lot of people don't figure out. So anything you could do to hold on to your kidneys as long as possible. My son was diagnosed about a year ago with polycystic kidney disease. He's changed his lifestyle, and we're trying to figure out, clinical trials because those weren't around when I was around. But new medications are what's going to change people's journeys. So I just want to reinforce what Dave was.
Yeah, and I just want to, if I could just say, a little bit of something. My first transplant, I love not going to dialysis, but to me, it was a little bit harder work. My first transplant was not the way this one is at all. So a lot of times people, they thought, oh, like she said, like he said, you got a kidney, everything is good, you are good. Not necessarily. It is a full-time job. My first transplant, I had many bouts of rejection. So that meant me having to go through these different procedures to get it run, back again. There were times, I mean, it was just, it didn't do what people said it was going to do. But again, I was grateful because I didn't have to go to dialysis. I did dialysis at home, so it was every single night. And so it just felt a lot better, but it was also a full time job. Second transplant was a lot better. They said, in the beginning when I first got it, they said, "Oh, it's a risky kidney," and a lot of people said they wouldn't suggest that I get it. However, I feel 100 times better than I did. I even feel better than I did a year before I crashed into dialysis. So, one of my things that you'll see with me and anything I say is do what's best for you. What feels right for you.
so I have a couple questions here about just looking ahead and the hope and innovation in CKD and in the care and patients can live, full and healthy lives, um, especially with recent advances giving us more tools than ever. And I know a couple of these questions would be best geared towards Dr. Miller, who I don't believe will be able to hop in today. But that being said, I'd love to hear if you all are aware of any recent advances in CKD that are exciting for patients to come. Or if you're not aware, what are some of the ways that you try and keep up with new research? Like how you are aware of upcoming clinical trials, Kevin?
I think this is something I would recommend everyone here is just go to clinicaltrials.gov. That has a list of all the clinical trials there. Type in what your medical condition is, and then you can take a look at what active trials, and that will tell you, all the trials that are occurring in the United States. And then you can go to the company and see where they're investing in. But that will tell you what the different trials, because one thing that I've learned is that sometimes the doctors are not telling the patients about the clinical trials because they're not involved with it. And if you go on there and you ask someone about the trial, you have the right to contact any doctor and ask about the trial. There's no one prohibiting you from doing that. And again, it's like if you're not getting answers there, then find someone else to get answers to, and you'll get those answers. So that would be my suggestion.
And I think anytime, like Kevin said, anytime I'm having a procedure, when I would go into the hospital, the first thing I would say, before we do anything, are there any clinical trials that that you may be able to, maybe you can get another core or tissue or anything like that. Let's go over and make sure there are any clinical trials, because like Kevin said, a lot of times they don't talk about them. The way that that I find out about clinical trials is I just try to stay involved with different organizations within the kidney community. That's kind of what we call it. I met Kevin at a major event by a large kidney organization. Kevin told me to apply for an advisory board. I applied for the advisory board, which opened up a lot of doors. The very first day that I joined the advisory board, I met Dave. So everything just comes around, and that's just how you keep meeting people and keep clicking. And that was, y'all, maybe 10 years ago. Are we talking? And they did little did they know they were going to be stuck with me forever, because I made them my brothers. But so that's how I find out about clinical trials also, just because of those connections that they've helped me with, and just knowing these guys. Because I may be a part of a board that they aren't a part of, or they may be a part of something that I'm not, and we can just mix information. And it's not just us three, there are plenty others. They're like a group of us that come together. But just that's how I keep in contact about clinical trials, and then also Googling and just seeing what's out there.
That's great advice. Keeping your community of people, just you all have an eye out on the same goal, and following the organizations that you all are a part of, just for the general community.
But that's something that people here can do. I encourage them. We're not going to be here forever, right? I mean, at some point, we'll hang up the shingle. And I think that that's something that it really is an opportunity for people to become involved and just demand better care. Because with these new treatments coming out, new trials, we have a really golden opportunity from us. And I just want to answer one question. Someone was asking about preemptive transplant. That's something you would tell your doctor you want to have a preemptive transplant, and then you need to find a living donor. But that's how that process would start. So anyway.
I also believe here in the chat, Yuri shared shared the clinicaltrials.gov link. So if you are interested in looking into clinical trials, the link is in the chat here.
I share that there are lots of innovations are coming.
Yeah.
There was a great question, Q&A about stem cells, and they're called organoids, and they are a byproduct of stem cells. They mimic kidney function, and they're a long way from reaching the mainstream. And that's sort of what you can say for a lot of the innovations that are in the pipeline. There are new wearable devices for people that need dialysis. There are implantables that are close to or maybe even beginning human trials, but all of these innovations are still years from being like being able to be like in mass production. So with that said, there's reason for hope, but it's definitely not time to say, okay, a cure is coming. I don't have to do anything other than wait for what's coming. You always have to be proactive, ask questions, and as Kevin said, just demand better care, demand better therapies, and do not accept the status quo.
Absolutely. So I think now would be a good time, coming up on the like 10-minute mark, to move into the live Q&A. We've been answering, or you all have been answering questions as the session.
Sorry, Bridget.
No, no, you're the ones answering. I love that they're coming up when the conversation is happening, because, at the end of the session, sometimes we moved on. So
Right, try to have to have a dialogue here, right?
yeah, I love it. So I want to see if there's any new ones in there, but I encourage you all to go ahead and drop them in. Now is the perfect time, and we can go ahead and answer some of those.
While we're doing those and looking for those, I just want to speak really quick because Mary Stamp asked a question about are there any teas, herbal teas, or anything you can drink? And she was referred to a doctor, of course. What I want to warn against, there are a lot of people out here saying, drink this tea, it'll cure your kidney problems. Drink this tea, it'll clear your liver problems. There's so much more to that. And then if you tell them, my doctor said I can't take that, because a lot of times they say we can't take that, they'll tell you that's just what they're telling you. It's not. What I've done to take is I've got an herbalism certificate. So I could understand exactly what was going on with these different teas and things like this. A lot of the ones that doctors are telling you can't take, there's a reason behind it. So I just tell people, you can go get a certificate and learn for yourself why they are telling you not to take these particular teas. That's not saying all of them, but those that they are, going out and advertising and saying, you want to reverse dialysis, you want to reverse this, and you want to reverse that. No, find out, learn about them yourself, and find out about them yourself so you can make the educated decision if you don't agree with what the doctor tells you, or if you are going against what the commercial is saying. That's just, I wanted to throw that out there because a lot of times people, don't want to talk about that.
I just like to reinforce that, how things have changed so quickly, positively in such a short time. And this is through, Dave, myself, and Nichole have all been members of the Kidney Health Initiative. And there's now, like when I went to Kidney Week this year, Kidney Week is the annual meeting for the American Society of Nephrology. It was so different than my first meeting in 2008. When I went there in 2008 professionally, it was all about dialysis. This meeting, dialysis was there, but it was a much smaller component of the meeting. That is so exciting that we're moving away from rewarding kidney failure to rewarding early intervention. And my challenge to everyone here is if you're not happy with it, become involved and do something. We've become involved in organizations and our voices have been very much heard within the Kidney Health Initiative. So, this is an exciting time, and my challenge to everyone is be part of the solution.
Raymond here said earlier that he was diagnosed 16 years ago, had no symptoms then, has none now, and has had 2 nephrologists. Neither did anything to determine why he has it. They both said it doesn't matter why, we just need to deal with it. I'm sure a lot of people can relate to that, unfortunately. And what all advice would you have? Does that just go back to the advocating for the root of the cause?
I guess it's like I guess I would ask the audience this question, is that if you were going to get different opinions to have your car done, right? You're not satisfied. I'll see people get 3 different quotes. If you're not happy after the 2, I would just ask for another opinion, or is there someone they could refer you to that maybe knows this area? Anyway, but that'd be my.
Yeah. Just from the way that the question was phrased, it doesn't come off as that they were being supportive. So just from that alone, I think you deserve to feel heard. And just like you're leaving the office confident in what you know.
And I'll just come out and say it. I think they might have been hiding their own ignorance by just saying we just need to deal with it. And that's just a sign that maybe you should, seek a 3rd or 4th opinion.
That being said, you, along with everyone else here, it speaks a lot to the fact that you're attending sessions like this to learn more and advocate for yourself and just be more informed. So thank you all for being here. It's a good time to tell the audience, but I think unless anyone has any last questions, we're going to shoot in here. If you come up with questions later, as we mentioned, you leave the doctor's office and then they come to you in the car. If any of those questions come in here later, you can go ahead and send us an email to info@Responsum Health, and I will pass them along and see if we can get any of those answered. Be sure to check the Responsum Health app in your email for the recording and to stay connected with our resources for ongoing support. We'll be sure to share all of the relevant articles that we have to today's conversation about exercise and diet and renal dietitians and just different resources for all of the great advice the panelists gave. And I just want to personally thank you, Dave, Kevin, and Nichole, for your advocacy, your time, willing to share your experiences, and I just can't thank you enough for everything you do for this community.
Thank you for having me, Bridget.
Yeah, I just want to say thanks for Responsum and for Yuri for doing this. I just wish we had more time to sit and talk to people, but we want to make sure we stay within our guardrails. We're not physicians, but the best person to talk to is a physician, like Dave says. If you're not happy, find a 3rd, find a 4th, and just keep asking until you're satisfied.
Right.
You'll get answers. So
Always a pleasure to help out our fellow kidney warriors. We don't have all the answers, but we do the best that we can, and we always will try.
yeah.
Yes.
Thank you for letting us be part of it. I always feel good after doing this. I feel like at least I did something today that was hopefully helpful. So I'll let our audience be the judge of that. So
I can already tell you, yes, Kevin. Thank you all again. And I look forward to getting to rewatch the session, share it with our community, the broader audience, and just get these empowered, feel good, self-advocacy feelings out there.
yeah.
Yes.
Thank you all again. Have a
Thank
great
you.
evening, everyone.
Take care.
Bye, everyone.
Bye.
Bye.
Take care.